We get this question a lot because people often wonder, okay, how much is too much? Am I pushing my body too far? Especially when I have either a chronic pain or I've just injured something. So if you just had an injury, we always say that we don't want you to try to push through, especially if you got a lot of pain with it associated with, some bad news bears, things like we talked about, the swelling, the weakness, the bruising, that you need to go get checked out. But if it's a little ache because maybe you pushed yourself a little bit too far in an exercise, well, I always emphasize cross training. So for instance, if you have a lower body injury, let's say you hurt your knee. So what I don't want you to do for a time is to avoid things like, squats and quad press and stuff that's really going to put a lot of pressure on the knee. And instead, maybe you do something like swimming or cycling to take pressure off that knee, but you're still working on that quad strength. And then you can speak with either your doctor, or sometimes Dr. Google does help. Don't tell anybody I said that. But you can look up some strengthening exercises when you have knee pain. There's plenty of good resources out there. Same thing with an upper body injury. If you have shoulder pain or a shoulder injury, so if it doesn't hurt to go past 90 degrees, so straight up and down of flexion there, then you can do things like bicep curls if it's not too painful, tricep kickbacks if not too painful. But you can always do things for your lower body. You can always work on your cardio, but just try to avoid, again, for a time, those exercises that bother things. And for anything that's chronic, we certainly want you to be able to continue to move, but like I've mentioned before, you want to adjust the routine because there are going to be things that don't bother you as much or not at all, and you can continue your workout routine. Are you curious about a particular joint pain that's bothering you and what to do about it? Well, comment below and I'll let you know what exercises I think could be beneficial to help you along the way.